Unhealthy eating habits have contributed to a lot of health problems epidemic today. Health problems like diabetes, high blood pressure, osteoporosis, arthritis, cancer, health disease, and so on. The good news is, if you can control what goes into your mouth and your body, you will live your best. For what you put into your mouth determines how well or sick you live. You and I know that poor diet is associated with major health risks that causes illness and even death. So, by making smart food choices today can help you protect yourself from all these health problems. Our integrative nutrition health specialist, Miss Betty Olayinka Folani Akinlosotu, aka Bufa, wants to see you living your best without any health issues. She made this known in her program showing every Sunday on Healthy Living with Bufa TV. She tells us how our food choice affects our health and how we feel today, tomorrow, and in the future. If you are opting for optimal health, from fighting free radicals to living your way into a healthy and beautiful body, here are some things you must do. Eat a nutritious, healthy, balanced diet every day. Practice your daily exercise and take your supplements, especially vitamin D, vitamin C, zinc, and chlorophyll to boost your immune system against free radicals that cause cancer and other diseases. Join us on this program every Sunday, 1:30 p.m. US time, 7:30 p.m. African time, and 6:30 p.m. United Kingdom time, where she educates on health and nutrition, as well as features professionals from various fields to sensitize you on wellness. See you there.
Streaming with us today on Healthy Living with Bufa. I'm your host, Betty Olayinka Folani Akinlosotu, aka Bufa, educating and sensitizing you on health and wellness. This health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic or social condition. Healthcare is a right to every living soul. That's what I know. Just like education. Education is a right to everyone. If you see that care should be a right to everyone living in any particular country, and there's no doubt about it, it's our right. It shouldn't be a privilege that one must have. No, it should be a right. Service of caring to prevent and treat illness is the right of the people and necessary to ensure the strength of the nation. The question we should be asking ourselves today are, is this right being given to us? Do we have access to this healthcare we are talking about in any country we live at this moment? If yes, are we receiving this service? And if no, why not? These are the questions we should be asking ourselves. And let me tell you today, and I have a good news for you, that all the answers to these questions will be answered shortly. I want to introduce to you today, our guest is joining us from South Africa. Wow. It's our son. Is a Nigerian South African. We all know him. Maybe some of us don't. But he started his career from Nigeria as a doctor. But the reason why he traveled away from this country to South Africa, and he's the one saving lives, many lives in this particular country. I have no idea why he left this country to work for other countries. Although it's still part of this Africa country, but why did he leave this country for another country? Oh my goodness. It feels so sad that this is happening in our country. This particular Dr. Odubanjo has worked in several hospitals, both in Nigeria and currently working in South Africa as a medical officer in the Department of Internal Medicine at Tembisau Provincial Tertiary Hospital, Olifantsfontein, South Africa. He did another internship at Far East Round Hospital, Spring, Johannesburg. He is currently a medical registrar in the Department of Internal Medicine at Charlotte Maxleke Johannesburg Academic Hospital under Vet University, Johannesburg. Like I said earlier, with all these specialties, he has multiple specialties as a doctor. He worked as an internal medicine doctor. He also a diabetic doctor, HIV, AIDS, hypertension, also one of his health condition that he takes care of. And he mentioned to me how many lives he has saved in this particular country. When we return, we will know the reason why he left this particular country, our own Nigeria country, to work in another country. Let's take a break. Wow. When we return, we'll find out the reason why he couldn't do this. He couldn't save lives he's been saving in South Africa.
What we've been waiting for. There is this saying that you are what you eat. This is absolutely correct. See, eating right is when we get all the essential nutrients our body needs from the food we eat daily. And these are minerals, vitamins, fats, healthy carbs, proteins, and fiber. Question we should be asking ourselves is, have I been feeding my body with essential nutrients? Many people have been advised to stay away from certain food. Why? Because they are very high in carbohydrates. But the study shows that your body system needs carbohydrates, which we call energy food. What is important is to go for healthy carbohydrates. Now, you have just one food item that can supply your body system with all these nutrients. And this food is called turmeric gari, trademark as gari didun. Turmeric gari, developed by Ajogbe groups and made from gari, turmeric, coconut, lemongrass extract is a product of an effort to enrich the nutritional value of gari, and the nutrients you get from it includes healthy carbs, minerals, vitamins, fats, proteins, and fiber. So whether you are super healthy, have diabetes, high blood pressure, and other healthy related conditions, the nutrition advice is to go for turmeric gari. You can eat directly as snack, soak in water, or make contact Gito Terminal African Market at this phone number 929-283-2653. For Nigerian market, please contact Ajogbe Groups at 292 Muritala Mohammed Way, Alagomeji, Yaba, Lagos, or contact them on phone 070-5656-5659 or 081-337-2939. Turmeric.
Welcome our very own brother, our son, our caregiver, our care provider, Dr. Oluremi Abiodun Odubanjo on Healthy Living with BOFA. You're welcome, Doctor.
Thank you so much. I really appreciate it. Thanks for the platform. And thanks to all our viewers all over the world. I really appreciate your bringing me in for this wonderful program. Thanks so much. I really do appreciate it.
Thank you so much. I want to first appreciate you for honoring us to be on the program today. I know when it comes to health of the people, you are always on the forefront. Especially what happened for the past 1 year, it's been so tense, it's been so life-saving. You know, everything, and you are there saving lives. Let's start by knowing you. And if I want to know you, like other people watching us right now, they also want to know you. We want to know you by telling us. We know you are Remi Odubanjo. We know you are a doctor, a medical doctor. We know you are a Nigerian. In fact, you are from Ijebu. I know you to that. All that, we don't want to know about it. We want to know you by telling us why you become a doctor, the reason why you chose that profession, and why all these different specialties. In few seconds, tell us.
Okay. I will say I've always wanted to be a doctor. That is for sure. Even when I was very, very young, I initially had this flavor for wanting to be a pilot, but I think everything changed after primary school, after I felt this urge to help and to make people feel happy.
Mhm.
And I think it's principally one of the reasons that I choose to be a doctor. I just want to help people and do my best in making people's life comfortable. Thank you.
Wow, excellent. The profession you choose, it's something that we cannot leave aside, something we respect so much. And health problem is a state in which you are unable to function normally and without pain. The human body can be truly incredible, yet totally bizarre. Now, I want you to tell us, how do I know I am diabetic or I'm hypertensive? Or is it possible for someone to have both health problem? If yes, what are the signs or symptoms I need to be looking out for me to see that, yes, I'm diabetic and also hypertensive?
Thank you so much once again. Let me start by saying hypertension and diabetes are both chronic medical conditions. They are very, very known. There are two popular medical conditions that you will find, not just in Africa, in any part of the world. Like I said, they are chronic medications. And these chronic medications are manageable and they are as well preventable. So one of the ways of actually knowing that you've got hypertension or someone has got diabetes is by first and foremost evaluating the symptoms of these two chronic medical conditions. And these chronic conditions have been tagged as silent killers. Hypertension, I will start it particularly, it's one medical condition that someone can have and can be asymptomatic for several years.
Mhm.
Asymptomatic, I meant by saying, would not even have a single symptom whatsoever for a number of years. And that's why it's one of the silent killers in the group of chronic medications. Diabetes as well is a silent killer. But the symptoms of hypertension, like I said, can be asymptomatic. But after some time, when the damage is set in for the person that have got hypertension, then some symptoms start coming up. One of the common ones that people usually complain about is headache. Talk about headache, can be frontal, can be generalized, can be parietal, which is just at the vertex of the head. And there are times when people complain about blurring vision, chest pain, being fatigued, tired, this malaise. So those are the symptoms that one can have. Because of our time, I will bring in diabetes as well, because they usually go together. Hypertension can cause diabetes, after a very long time, particularly in people that are taking some medications that can predispose them to having diabetes. These medications are used for high blood, but can also predispose people to having diabetes. And also, there are some other drugs, your corticosteroids and some other medications that can predispose to diabetes. Diabetes as well is also a silent killer and can also cause hypertension. So these are the two silent killers that people don't really know. And in terms of diabetes, first and foremost, I always tell people the best way to treat these conditions is to prevent them. And if I have to choose for someone between hypertension and diabetes, I'd rather choose hypertension first for that person than choose diabetes. I'm not saying one is better, but I'm telling you, these are two medical conditions that can cause problems in any system in the body. For diabetes, obviously, in some people, you will have what we call family history of diabetes. These are the kind of people that we try to look out for if they've got significant family history, like the father is diabetic, the mother is diabetic, they've got history of diabetics amongst their siblings. These are the people we look out for and start monitoring. And apart from that, the classical symptoms of diabetes that one should start looking out for is when you start having this urge to pass urine a lot, in which we call polyuria. And in some patients, they can have what we call polyphagia. They eat excessively, and they tend to have what we call loss of weight that is not intentional. You know, a lot of people can decide to jog, not to eat junk food, not to eat carbohydrate because they want to lose weight. But in most diabetics, even when they do that, it's unintentional, they lose weight. And there is also what we call polydipsia. Polydipsia means excessive drinking of water. So these are the symptoms, and particularly the polyuria usually is nocturia, in which they wake up every night. Like a lot of people will sleep, some don't even go to the toilet to pass urine at all before they wake up in the morning. Some do maybe once or twice. But in the diabetic patients, they tend to go frequently to pass urine. So these are the symptoms, apart from having a family history. These are the cardinal symptoms that people should look out for when they've got symptoms that is suggestive of both hypertension and diabetes. And to add to it, like I said, because these two medical conditions are silent killers, they can also present as an emergencies. For instance, diabetes has got two forms. We have what we call type 1 diabetes, and we've got type 2 diabetes. Type 1 diabetes, usually, it doesn't mean it occurs only in young people. We've had older people that are presented to emergencies with type 1 diabetes, but usually it occurs in the younger age group. You understand? This type 1 diabetes, it's something that usually will present as an emergency, in which we call diabetic ketoacidosis. That's what we usually, a lot of young people don't know they've got diabetes, despite having family history, but the only time they are presenting to the hospital is with an emergency. And usually it's in the younger age group, and we refer to them as type 1 diabetes. I don't want to go into the technicalities. The type 2 diabetics are the older ones. And like I said, they can have type 1 as well. And we also have this set of people that move in between type 1 and type 2. So usually, like the hypertension, they can also present with emergencies. They never knew they've got hypertension, and the very first time they are coming to the hospital is with a stroke. And you check their BP, you realize that, wow, the BP is 200 over 140. Right. And they tell you they never had a headache. The only time they are experiencing this usually is they just woke up in the morning, or they discovered that they couldn't talk, or that part of their limbs are weak, and they decide to present to the hospital. And that's the only time they realize that they've got hypertension.
Wow.
Diabetes as well, they come in emergencies. The type 1 will come with what we call DKA.
Mm-hmm.
The type 2 will come with what we call HHS, hyperglycemic, hyperosmotic syndrome, in which they can be very dehydrated. And that's the only time that they usually know that they've got diabetes. So these two conditions are silent killers, and we should work and do all our best to prevent them from happening if we can.
Wow. Thank you so much, Doctor. You see, the reason why I give you much time to explain this is because right nowadays, this time at this moment, we realize that those that survived this COVID-19 are all the people that their heads are not compromised. Those that couldn't survive it, I mean, those that lose their life into it, are those that their, heads have been compromised. Their immune system have been, one way or the other disabled from their system, body system. I want you to tell us something about, you mentioned hypertension and you connected it to this diabetes. Now, I want you to tell us in a few seconds, what is the difference between hypertension and heart attack? Because I realize that hypertension can lead to, stroke can lead to hypertension can lead to stroke. So what of heart attack? Because it's also had to do with heart. Tell us, I want you to advise our viewer on that. Heart attack.
Okay. Like I said initially, hypertension, it's a multi-systemic disorder.
Mm-hmm.
After a very long time, it can cause what we call target organ damage. And this can occur in any part of the system, any organ. It can start from the CNS, which is the brain, and the person presents with stroke, like you've said. And even the stroke can be of two types. There's what we call ischemic stroke, in which the blood vessel to the brain is compromised.
Wow.
It's being short-cut, and that causes stroke. The other one is what we call hemorrhagic, in which the vessels, I'm just trying to simplify this for viewers, in which the vessels in the brain get dilated and they couldn't take it anymore and they burst. And when these vessels burst in the brain, they cause bleeding. And this culminates in what we call hemorrhagic stroke. And I've got experience with that because my own father died of hemorrhagic stroke. When we talk about heart attack, it's quite different from hypertension, but hypertension is a cause of heart attack. Like I said, hypertension can affect the brain, can affect the heart, can affect the kidneys, can affect any organ in the body. But in heart attack, it is restricted to the heart. That's why we call it heart attack. It's like, I will put it like, heart attack is a form of brain attack, if I can use that analogy. Like I said, there is the vessels that are giving blood supply to the brain. They are blocked.
Yes.
For a lot of reasons, particularly what we call atherosclerosis. And I mean, I don't want to go into the intricacies of that, but they are blocked. The blood supply to the brain is cut short off and somebody develops stroke. It's the same thing in the heart. When the blood supply to any part of the heart is being cut short, for some reasons, the person suffers heart attack. Wow. Hypertension can cause what we call hypertensive heart disease that can predispose a patient to heart attack. So there are two different things, but hypertension is one of the causes of heart attack.
Wow. Oh my goodness, this is so informative. Viewers, I know a lot of people, maybe you're on this program or you have anyone that is going through or suffering from this particular health condition we are talking about on the program today. I want you to please share this program. We have a lot of information to give on this program today. I feel so bad when I see this particular community. I mean, people living with HIV, being rejected and isolated. I want you to advise us as one of the doctors that treat and specialize on this particular health problem, disease. Your advice on HIV/AIDS. Please go ahead.
I think the problem with Nigeria is putting the cart before the horse. And I believe in any health issue, there should be both promotion and prevention. And I think this is what is lacking. Health education, promotion, and prevention is what we need to make people realize. In South Africa, where I'm currently working as a medical doctor, HIV is being seen as a chronic medication. We've seen HIV-infected patients that are living even more than people that don't even have any chronic medication. But the stigmatization in Nigeria, I remember as an intern and houseman in Lut, we used to rotate through what we call PEPFAR. And I know I rotated through PEPFAR. It's an HIV program that is set up by America to assist Africans. But I remember very well that a lot of my colleagues refuse completely to do that rotation because they are scared of being infected. And I don't see it as fear because they are doctors. I think they are not just comfortable mingling around. So it's stigmatization. It's from the healthcare workers, from the government, from the family. So it's something we need to work with essentially. And I can tell people diabetes kills more currently than HIV. And they are both chronic conditions. So we need to work on this stigmatization. And that is the problem with Nigeria. We need to let people understand that these problems, these conditions, they are not just preventable. Like I always tell people, and I've seen that happen a lot of times back home in Nigeria, where some doctors will tell you because your BP is fine now, you should stop your medications. HIV, as at this time, doesn't have a cure. Hypertension doesn't have a cure. Diabetes doesn't have a cure. These are chronic medications that are manageable. And people don't get stigmatized because they've got diabetes. They don't get stigmatized because they've got hypertension. But when it comes to HIV, it's like a 10-10 set. I mean, people just tag you as, people don't even want to use the same spoon, the same cutlery, the same plate with you. And I believe strongly that these are all entangled and need to be hinged on health promotion and health education. And that's what we need.
Wow. So we need the health information, health education for our people, right? Wow. Okay, I agree with you. Now, let's talk about healthcare system in our country. This is what people have been waiting for. What you've been saying so far is what people are also waiting for. But this particular one, if we talk about health problems and there's no way out of it, how to prevent it, no infrastructure, no tools, no hospitals to take care of all this problem, there will be a problem, isn't it? So we're talking about the healthcare system in the country now. And the principal threshold of a nation is its health. And the way a country finances its healthcare system is a major determinant of health of its citizens. Today, Another important challenge in Nigeria's healthcare system is the lack of use of evidence for planning and policy making. And I want everybody to agree with me on that. Now, doctor, the question is, what are the bad side of healthcare in Nigeria, and how do we revitalize, or should I say reform it?
Thank you so much. The basis for any disease control, prevention, and treatment can be divided into making a diagnosis for that condition, using a laboratory backup to now complement your diagnosis. And the third component is treating what you've diagnosed. And I believe the fourth one is preventing further progression of what you diagnose. Like, for instance, we're talking about hypertension and diabetes. If you diagnose hypertension, if you diagnose diabetes, you have to look out for complications in these patients. What are the complications? Do we have damage to the kidneys, damage to the heart, damage to the brain? And these are the things you will now use laboratory backup. And I believe Nigeria has got more than enough talents, intelligent doctors that are even far, far much better compared to knowledge base in any other country. But the problem now is the laboratory backup. It's where we are now lacking. I told you about my dad who died of hemorrhagic stroke. I have admitted, I have taken care of hundreds, thousands of patients with hemorrhagic stroke here in South Africa. If you see a patient coming with symptoms or clinical signs suggestive of hemorrhagic stroke, it is just, there is no two other way. That same day, that patient should have an urgent CT scan of the brain. My own father never had one.
Wow.
Because there is no single one where he is, and there is no single one kilometers around where he was admitted. That is one. My own niece also died because they couldn't even make a diagnosis.
Oh my God.
In this same route that I walked in. Somebody that has gone, that has got an issue with the brain, that is breathing in a very funny way because she's gathered what we call edema in her brain. She didn't get a CT scan because there is no functional one in the hospital she was taken to.
Wow.
ICU wants 250,000 per day. So you can imagine. But the truth of the matter is our laboratory backup in majority of our health institutions are faulty. They are not even there. So you can imagine if I make a diagnosis of meningitis, complicated meningitis in a patient that has got all features to suggest meningitis, and I don't have a CT scan to see what level of edema, water gathering in the brain that this person has, how am I going to help? The only thing my father needed is what we call a borehole by a neurosurgeon. Just go into the brain and suck out the blood. But this requires a CT of the brain to be done first to see what amount of blood is in the brain. But this never happened. I've got another example of a friend who is a medical doctor here as well, whose father has what we call pulmonary embolism, where you've got clots in your lungs. And in the whole of Osun State, there is no CT pulmonary angiogram. It's a special CT scan of the chest to see whether there are clots in the lungs. So in terms of theoretical diagnosis, I think we were trained in that aspect. We know what a DKA is. When a patient comes with a diabetic emergency, we can see this with DKA. But we've got laboratory backup. There is a machine we call arterial blood gas that we should be doing every 4 hourly or 2 hourly, depending on the presentation of this patient. And I can tell you categorically, I finished from Obafemi Awolowo University. I've never seen one blood gas machine in my life. As a student, in Lutz, as an intern, I never saw one.
Wow.
And you come to another African country like South Africa, where each ward has one. And I start thinking, I have a lot of friends, I have a lot of groups. When we start talking about Nigerian issue, we don't finish. We don't even have, we eventually we just fade off, not discussing it. So we need a laboratory backup. We've got intelligent doctors, we got lovely doctors in Nigeria. But the problem is, they make this diagnosis, there is no laboratory. And I remember I worked in a hospital owned by a senator. I don't want to mention him now, in Lagos State, of which when we do a CT scan, as at that time, I don't know now, we will send that CT scan to India, where the CT scan will be reported and sent back to us after 2 or 3 days. And most of the time, the patient is already dead by the time the report is coming back.
Right.
So it's a complex issue. Our government are not even going to mince words. They have failed us in terms of health.
Okay, now we all understand that our governments have failed us. Now because I always say it on this program, if we want to implement a change in any country, it starts from individual person.
Sure.
It starts from our home. Doctor, you and I know that Nigeria's health expenditure is relatively low, even when matched with other African countries. And what we don't understand in Nigeria is there is a realistic evidence that the health of a nation significantly boosts its economic development. And that is why attaining a successful health care financing system continues to be a challenge in Nigeria. Now, let me ask you this question. What is the role? Because I just said it that it starts from our home before it gets to the government. What is the role of federal, the state, and the private sector and individual people in the country? What is their role to ensure good quality healthcare system in the country, especially our country, Nigeria? Because we have some people that are even richer than Nigeria. You don't know, the Nigeria itself. We have many people, rich people.
Basically, the federal government, I mean, the word is federal, should take responsibility for individual health of our citizens. That is what a country must do. I always tell my friends, stop comparing Nigeria to US, to UK, to Germany, Canada, Australia, New Zealand. Let's start with our other African countries. First and foremost, because I'm going to just do I have to do what we call a comparison, because this is where I am. I've been away from Nigeria. I don't know what level things are, but from all the conversations I've had with my friends, it's not that things have really changed per se. And there are lots of doctors moving out of Nigeria, and UK is accepting them. But establishing health facilities that are functional. I mean, the private hospitals in Nigeria, there is no way. I just told you about my own niece who needed an ICU in Lagos University Teaching Hospital, not private now, and they wanted 250,000 naira per day. Tell me, how is Lutz different from a private hospital? So the problem is, When these federal government hospitals, teaching hospitals, federal medical centers are being run as private, doctors are doing what we call EMO. I still remember that word very, very well. EMO is when you prioritize patients in emergency room ER, where if a patient has got money, you take blood from that patient immediately because you are getting something back from the patient.
Mm-hmm.
These are things that you hear and you witness and sickens your heart. So the federal government must come on board. I know Nigeria at some point in time has got this act of National Health Insurance Scheme,
Mm-hmm.
which, as at when I was in Nigeria, I don't even know whether it operates or not, because it's not beneficial to the poor.
Mm-hmm.
Here in South Africa, healthcare is free. And as a matter of fact, I can't even count the number of Nigerians that have used the facility in this country free of charge, despite all these xenophobic issues that people are talking about.
Mm-hmm.
I have seen patients in all majority of the hospitals I've worked that will leave Nigeria, come to South Africa, get dialyzed, renal dialysis,
Mm-hmm.
free of charge, not a single cent. You can count the number of dialysis machines in Lagos State. And people are, you see, when the government is like a family, if the head of the family doesn't have directions, it will affect the wife, it will affect the children,
Mm-hmm.
it will affect the finances, it will affect the way forward of that family. And that is what is happening. I always tell my friends that Nigeria is like a patient on ventilator when it comes to the healthcare system. They say I know the patient is stable but critical. You start wondering, and that's what is happening. Our healthcare systems, our government, they are putting our healthcare system into a stable and critical state. It's not even stable. I wouldn't even call it stable. So the federal government must come on board. They must build, you see, even if you decide to build more hospitals, it doesn't make any sense.
That's
because
right.
we don't even have the human resources.
Mm-hmm.
People are leaving the country to go outside. A friend of mine used to say, don't you want to come back and do your best for your country? I said, that would be so lovely. I'll give you an example. I did 1 year internship in Lutz. When I did my obs and gynae, I didn't do a single cesarean section. And I did obs and gynae. I came to South Africa, did 2 year internship training. When I did O and G, I did 48 documented cesarean sections in 3 months.
Wow.
So now, I mean, it's so absurd. Let's be realistic. Now I've been equipped with a lot of things that my government has refused to put in place. So what am I coming to help the community with? The federal government has to put a policy down in which some of the medications we are using, you go to these hospitals, the doctor sees you, they will give you a prescription to go and buy drugs in front of the hospital, which you don't even know where those medications are coming from because there's no government policy that is monitoring them.
That's right.
So these are the kind of problems. I have a friend who owned a hospital in Ogudu. Is that one? I refer to him as a patriot. I called him 3 years ago. I couldn't get through to him. I asked other friends. They told me, no, this guy has gone to UK. He's practicing in the United Kingdom right now.
Wow.
And this guy, when we finished from Ife, he's always telling me Nigeria is going to be great, which I believe she's going to be great. But what is our government doing? OAU is the renal center for the country. How many dialysis machines has OAU, Teaching Hospital Complex, got? How many CT scans are functional in Lutz? Do we have CT scans in our federal medical centers. These are for the government.
Mm-hmm.
For the states, it's even worse. Because, I mean, the state is supposed to like take care of its own. It's not even happening. You know, I get called from Lagos by people telling me they are taking medications for cancer, and there is no doctor explaining the side effects of their medications to them. It will never happen here.
Yes, that's true. Same thing here.
I'm private.
Let me buttress your point right there, because our foundation also deal with persons living with disabilities, the widow and the orphans as well. I've so far I've reversed so many health conditions through diet. I'm not saying medication or surgery, through diet, the food, because there's some medical problems, like health problem we don't need surgery or medication for. But all we need is just to work on what we put in this mouth. I want to stand on my point, because we don't expect government to do everything for us. It is not possible. Even I know where we live today, that not all the things we benefit from today are provided by the government. Private also do their own parts. Individual do their own part. For instance, when this pandemic happened in the whole world, New York is the center. We have the high numbers, the rate of death recorded in New York. And we've seen a lot of people donating, giving this and that. The entertainment industry, they are individual celebrities. They contributed marvelously to people, to the community. So I'm still saying that today we have more clinics than federal government hospitals. I mean, as in each state today, we can count numbers of private hospitals which people are not even visiting a general hospital anymore. They make use of private. And I've seen many people telling me that they can't treat me in the private hospital because I don't have money. Let the change start from us. If they reject me in the private hospital and we were talking, oh, my government is not doing it, I'm also one of these government we're talking about, because I live in that country. Let the change start from us. I want you to address this situation, and I want you to focus on the private. We know that our government have failed us. We know that. Now, let's bring the change now from us, from our homes. That, like I said, we have Nigerian people who are more richer people. Oh, let them know that they also parts of change.
The private sector, I always say, there is no difference between 6.5 dozen, except that in their figures, there really, really is no difference between the private establishments and the government. I will tell you this, the backbone of any healthcare system in any country is primary health, not the private. Primary health is the backbone. I remember our last discussion, you told me you went to see your private GP. They are called GP, they are not specialists. So it's only when your GP realizes that, you know what, I'm treating over, but I don't think I can handle this condition, then you now go to the secondary level. The private in Nigeria, the sector, private sector, it's basically profit maximization. I've worked there. I worked in 3 different private, I won't say hospital, like you said, clinics. And all they just want to do is maximize profit. Here, if there is an emergency and somebody enters into a private hospital in South Africa, by law, you are supposed to treat that person.
That's correct.
You can always claim the money from the government. You stabilize the person because it's an emergency. When the patient is stabilized, you now send to the government hospital. And there is a pathway where you can claim from the government for whatever you have done.
Exactly.
Because private establishments are not run by government, but they are collaborating together.
Mm-hmm.
But the problem with our Nigerian setting is that I remember, I won't mention the name of the hospital I worked. That hospital takes care of all emergencies, all road emergencies from to Ikoro. That is for BRT alone. Getting money from BRT because you are involved in BRT accidents. But when a private person comes, he calls me and tells me, Dr. Odubanjo, 30,000 before the patient gets a bed. And I have a patient that is dying right in front of me. Wow. So the problem is this: if only the government can tell the private establishments severe malaria, these are the forms you must fill to claim from us. But the issue is this: if they fill those forms 1, 3, 4, 5 times, and the government is not reimbursing them, they will stop. So the private sector in Nigeria, until the government, and I'm talking about a government that has got a vision, a government that understands the power of primary health, because if the primary health is solid, there won't be need for private to be overcharging or making people's life miserable because of money. Cesarean section, 100,000 before you even get incision. Those are the problems. So I think for our senators, for our government officials that are going about driving limo, Lexus, I'm telling you, one car of a particular person's cars that I've seen on YouTube can produce 3 solid ventilators for Federal Medical Center in Lagos State.
You're right. We have them.
We've got lots of them.
Yes.
But like I said, it's about profit maximization. They don't care. Whether the person dies or not is not the problem. I told you about a hospital that somebody had an Okada accident. Opalende, first consultant hospital in Opalende. And almost I'm seeing the muscles of the thigh of this person.
Wow.
And nobody could take this person to the hospital just right there, and he was bleeding to death. Just because he can't even afford to. They won't even allow him in. And he's dying.
That's right.
And here you will find a chopper, helicopter, going into the rural South Africa to pick up patients, to bring them into a teaching hospital.
Right, because they want it fast. That's why they use helicopter. Oh my goodness.
It's because they've got the people's whatever in their hearts. The government wants people to have free health and if you're fine health-wise, the country is happy.
That's right. Oh, doctor, you've said all. I don't want to, if you continue talking about this because it has to do with life, we won't leave this program today. I want to appreciate people. Let's have our health nutrition right now. And the doctor is going to be telling us the importance of this nutrition in our body system. 1. Then 2, since we are discussing on HIV today, on Health Corner, also on nutrition, the foods you eat to prevent it, we want doctor to tell us, and we are right now on nutrition segment, which our Dr. Odubanjo will also be our guest, telling us, instead of me telling you the food, eat this, eat that. So I want it to come from our guest, is a doctor that also treats HIV. I know not all the doctors can tell you the foods you eat, but they have idea the importance of nutrition. So that is what I want doctor to tell us today, the importance of nutrition. What do we do? Let's not look at the HIV. In general, what is your advice when it comes to good diet, healthy food for our body system?
Thank you so much once again. I just want to quickly state the lifestyle modifications as regards hypertension and diabetes, because it will be very unfair not to quickly talk about that. And it also links with nutrition. And in terms of lifestyle modifications, weight reduction, it's one of them. The more weight you gain, the more you predispose yourself to hypertension and diabetes.
Mm-hmm.
And you also have to exercise. Exercise, there's been lots of data worldwide that has proved that if you are hypertensive, exercising maybe like 150 minutes per week can actually drop your BP from between 5 to 8 milligrams mercury, millimeters of mercury. So these are the kind of things we must also let people know. Then we talk about alcohol, quitting smoking. Then to come to the one you really want me to talk about, which is our diet. I always tell people, if it looks good, if it smells good, if you appreciate it, eat it in moderation. And like I always say, nobody knows it all. And I'm the kind of doctor who always like to tell my patients, I can only tell you, eat this, eat that. But we've got people that are trained to do this. We've got nutritionists, which you're part of. We've got dietitians. These are the people that will tell you more. But in terms of diabetics, hypertensive, we know for hypertensive patients, you have to reduce your salt intake because the more salt you put into your body, the more you push your BP from not being controlled. If you're diabetic, we both know you can't go on eating too much of carbohydrate, sugar, Coca-Cola, junk foods. These are the things that we've so much like embraced and it's causing a lot of problems, increasing the cholesterol in our system, causing the arteries to get diminished and stenosed and blocked, causing heart attack. Those are the kind of things. But I always tell people, if you are a nutritionist, you can't be a nutritionist and at the same time be a doctor. You have to choose one. So people must understand, when you have reasons to advise people on food, healthy living, always involve a nutritionist.
Thank you so much.
Thank you so much. I hope I've been able to answer that.
Yes, doctor, you did. Thank you so much for coming on the program to take care of us, because we don't have to be in the hospital before you take care of us. Today, you did a wonderful job taking care of us today.
I appreciate
it for being health caregiver, a provider, a lifesaver. Thank you so much, doctor. It's been a pleasure.
Thanks a lot.
God bless you. And I wanted to say thanks to Madam and my kids back there.
Thanks a lot. Bye.
Oh my goodness, it's been so wonderful on the program today. And I believe somebody is blessed, somebody is educated, empowered, informed today on healthy living with BOFA. Ah, my goodness, it feels like we should just stay on till tomorrow or till next week we bring you. That is all we can give on wellness today. Oh Lord, I wish you all good health. Once again, thank you for all you've done so far to stay up till this time on healthy living with BOFA today. And next week, I'll see you all. By God's grace, my love is coming from Betsy Olayinka Folari Akinlosotu, your one and only host on this program. I'll see you next week. Bye. And have a wonderful